Welcome to the MRO Exchange, Connecting Healthcare Executives, your go-to podcast for staying informed in the dynamic healthcare world, where MRO discusses industry trends and topics with prominent healthcare leaders. In each episode, we delve into the intricate landscape of the U.S. healthcare system, shining a light on the immense responsibility shouldered by providers to effectively acquire, manage, and share clinical data with data consumers. Join MRO experts and healthcare executives as they navigate the important dynamics within this highly complex environment. From the surge in healthcare ecosystem demands to the influx of structured and unstructured data scattered across diverse systems, along with the ever-growing compliance, security, and privacy expectations, the MRO Exchange, Connecting Healthcare Executives, unravels it all for you. Tune in for a comprehensive exploration of the pressing issues shaping the healthcare industry today.
Hi, welcome. I'm Adrienne Morrell, and thanks for tuning into the Exchange, where we connect with healthcare executives. You can learn more about me and my background at MRO website or mrocorp.com, or connect with me on LinkedIn. Today, I'm here to connect with a good friend and colleague, Lauren Riplinger, who's the Chief Public Policy and Impact Officer at the American Health Information Management Association, otherwise known as AHIMA. We'll be talking about what's going on in Washington, D.C. post-election, and what to expect in the coming year as it relates to legislation and policy that impacts the health information management industry. Lauren, welcome to MRO Exchange. So happy you could join me. It's always great to be with you.
Thanks for having me.
So I thought we'd start off by way of introduction. I'm going to start off with a couple of questions to ask Lauren to get a sense of her background and her career path in healthcare policy. As I mentioned, Lauren is AHIMA's Chief Public Policy and Chief Impact Officer at AHIMA. Lauren, tell us what you oversee at AHIMA and how long you've been with the organization.
Yeah, thanks, Adrienne. And just thanks for the opportunity to chat with your audience today. So I've been with AHIMA, it'll be 9 years in 2025, so quite a while. And in my role, I oversee our policy and government relations team in Washington, D.C. In addition to that, I oversee some of our more impactful programs within the organization. In particular, we have an initiative called Data for Better Health, which focuses on how do we improve the collection, sharing, and use of social determinants of health data to improve health care outcomes, as well as a foundation that we currently have as well. But mostly on the policy side, really out there talking to administration officials and folks on Capitol Hill about the issues that matter to our members.
Awesome. And tell us how you began your career. Did you begin on Capitol Hill?
Yes. So great question. I started on Capitol Hill as a staff assistant. So folks that don't know what the staff assistant role is, they're basically the glue that holds the office together, but they're also the person that answers the phones, opens the mail. So right out of college, knew I wanted to be in Washington and focus on policy issues because I had done some internships out here. But then, had an opportunity through a variety of different kind of personal connections to work for my hometown congressman. So started as the staff assistant and then moved to a legislative assistant working on healthcare issues. So I've been working on issues related to healthcare really since 2002, so quite a while. And then basically was on Capitol Hill for 11 years. And when I ended my career on the Hill, I was serving as chief of staff, which oversees the congressional office and really advises the member of Congress on both policy, but also kind of political matters. And so from there, I went to a small nonprofit organization that really focused on health IT issues. So this was really around the time when the HITECH Act was enacted under the American Recovery Act, and really had a chance to dig into these issues related to health data and working closely with HHS on open data. At the time, they were very focused on that. And that's how I got to know AHIMA and its members and its focus on health information. And since then have been with AHIMA working on health information related issues.
That's amazing. That's a great career run. And it's so true. As a former staff assistant as well, where I started off my career, You do. You see everything, and it's a great entry point for a career, and I highly recommend it to a lot of people who are interning on the Hill as well. So that's great. A great background, Lauren. We're so lucky to have you. And then you also have a law degree. Is that right?
I
Yeah.
do, yes. So I still can't believe I kind of did this at the time, but I went to school part-time while I was working on the Hill. So would really start my day working on the Hill, go up to the law school, and then spend my evenings there, and did that for 4 years. So it was, I still don't know how I spent that many hours and was able to come to work and actually function on so little sleep, but somehow I managed it.
That's great. Well, thanks so much for all of that on your background. Impressive. So let's get into a couple of questions about AHIMA, the organization you're with now. You guys have a robust policy agenda, and I know we're working into a new Congress, which I'm sure you all are working and thinking about. But tell us, what's sort of on, top of mind and what's on AHIMA's agenda.
Yeah, great question. And so our board is actually in the process of approving our 2025 agenda, which will look a little bit different, but very similar to 2024, which folks can check out at ahima.org. But, ultimately, the way we think about our advocacy agenda is that our vision as an organization is to transform health and healthcare by connecting people, systems, and ideas. And that starts with health information because it's the most powerful currency for change in healthcare today. And so as we think about our 2025 agenda, it's really about how do we leverage our knowledge and expertise of health information to influence the public policy environment for the benefit of obviously our members as health information professionals, but also individuals and communities as a whole. And so we kind of think about our advocacy agenda in 3 large buckets. The first is around, how do we think about improving that individual's healthcare journey through access to information, privacy, and equity. And so in that context, we think about it of what's the opportunity to demonstrate our expertise on health information? What is our mastery of the issue, right? The second bucket is really around ensuring the quality, integrity, and usability of healthcare information. We know, in particular, data usability is going to be a key issue in health IT for the next 10 years. And we are working closely with folks like the Sequoia Project on their data usability Taking Root initiative to really, ensure that we're pushing best practices out there into the environment, but also looking at what are the policy levers that we can pull, such as around the trusted exchange framework and common agreement to help build that better data into the system, right? Because otherwise it's garbage in, garbage out. And then the last bucket we have around our advocacy agenda is advancing healthcare transformation, which is a very broad bucket, but it includes things like how do we look at, leveraging quality data for value-based care models? How are we thinking about better integration of clinical and administrative data? So, we know electronic prior authorization is a huge challenge in organizations today. How are we making sure that as we further automate that process, that it's being done in such a way that actually really meets the needs of the end user, which includes patients and providers, as well as health information professionals. We talk to folks every day who say, I have 100 people on staff just working on electronic prior authorization. So how do we get to a better state that actually meets those needs of that end user? So I talked about the opportunity to demonstrate our expertise and that mastery of the issue. So this is really about, how do we demonstrate our expertise around privacy, data usability, accuracy, and completeness of the data. The second is really how do we look at issues where there's an opportunity for AHIMA to lead? So, our patient matching work is really a great example of this, and working with others in the Patient ID Now coalition to introduce the Match It Act. How are we thinking about the collection, sharing, and use of social determinants of health data to improve health outcomes? And then kind of the third piece of this agenda with relative to those pillars that I talked about is, we have to make sure ultimately that we're reflecting the operational concerns of our health information professionals and our members. So I talked about electronic prior authorization as a great example. A lot of the challenges that our members are struggling with of how do I keep an individual's health data private, confidential, and secure in light of, I'm supposed to do one thing at a federal level, but I'm being told to manage it differently at a state level, which I know is a huge concern for many of your folks as well.
Yeah, what a robust agenda. Nothing short of, big issues to tackle. And you're right, a lot of privacy issues, and we'll get into that. I think, we'll continue to work on coming year. So that's really exciting. Thanks for that great overview. So moving into, Washington, D.C. specifically, we're kind of in that, right, lame duck time period, which is post an election, but the new Congress and new administration in this case has not come in yet, has not been sworn in to their new roles. Mm-hmm. So tell us what your sort of predictions are, your crystal ball on sort of what's going to happen in this lame duck period.
Yeah, the sprint that we'll see, right? And so, as you mentioned, the federal government is currently funded up until December 20th. And so the biggest question out there is, will Congress pass a budget that funds the next of 2025, or will they do a short-term extension? And my crystal ball is telling me that the only thing that matters for Speaker Johnson right now in the House is his election on January 3rd for speakership. Now, obviously, we know he has support in the caucus right now. He has support of the President-elect Trump as well. He's been very clear in a lot of his, interviews, et cetera, that he fully supports Speaker Johnson. But we also know there's a very narrow margin in the House right now in terms of the control that Republicans have. And so knowing that, my crystal ball tells me that we'll see a short-term extension to keep the government's doors open, most likely run till February, maybe even March, because he's not going to want to rock the boat by cutting a deal with Democrats in the House and potentially lose votes for that January 3rd election. So that's what tells me that we'll see in the next couple of days another push for a short-term extension from the House. I suspect the Senate will go along with that. Many people also like to get back for the holidays, which we know are quickly approaching. So that's, I think, the biggest thing that I see on the horizon the next couple weeks. The other pieces, I know there's a lot of talk about extenders, particularly from a healthcare perspective. We may see some movement around Medicare reimbursement to avoid cuts for physicians. I still think there's a big question mark in terms of whether or not they'll be able to get to consensus on that, or just wait until the new Congress to try and address that. The other thing I'd say that's probably not as healthcare related is the National Defense Authorization Act. This is something that inevitably gets done. Historically, the Armed Services Committees on the House and Senate are always dedicated to getting this done every year. We could see some movement on that legislation as well, finalizing that and getting that to the president for final signature. But those are kind of the big ticket items that I see in the next couple of weeks. We'll see movement on.
Yeah, that makes sense. I know there's nothing like a deadline between them and the doors for the holidays, right?
Yes.
Strategically put right on December 20th. So gives them a couple days, but not much.
Yes, totally agree. Puts the squeeze on, right, so to speak.
Good predictions. We'll see what happens here. So then in terms of some of the policy issues on the health IT side, there's been, Congress doesn't move as quickly as, say, the states, and they've begun work on, in the interoperability side, on privacy and cybersecurity. What are your predictions, for those issues going into the next year as well?
Yeah, a lot of uncertainties, right? Obviously, we have a lot of new members coming into this Congress, so we have to figure out what are their priorities. We do have some changes in terms of chairmanships of the committees of jurisdiction that have jurisdiction over a lot of these issues, like privacy and interoperability, which I'll speak to in just a minute. Um, and then obviously the new administration, right? So a lot of the political appointees will be termed out at the end of the Biden administration, and President Trump will want his own people in there. So let me take the administrative side first. Obviously, we have some pretty good idea. We know who he's nominated for CMS administrator, HHS secretary, et cetera. Those will all have to go through Senate confirmation. But for purposes of our discussion in health IT, the biggest question is who's going to be the next assistant secretary for technology policy, right? And that's a big question mark for a lot of folks right now. There's a lot of discussions going around of, what direction is the president going to go in terms of this individual? Is it going to be someone who is much more traditionally focused on interoperability, focusing on TAFCA, those types of issues that we know are already out there, information blocking, APIs, those types of things? Or because ASTP now has a chief AI officer reporting into it, at least under its current structure, which could also be subject to change, is Trump going to look for someone who's more of an AI czar, who can really focus on AI-related issues in healthcare? We've heard reports, obviously, that the president is looking to appoint a broader czar who focuses on AI-related issues. So we could see someone who's much more focused on that. So time will tell as we kind of move forward, what type of candidate he's really looking for there. In terms of Congress, I think we'll likely see something related to cyber next year. This issue is not going away, particularly with the, cyber attacks that happened earlier this year, and they continue to be on a rise. So I think there's a clear, indication from the Hill, particularly with introduction of the Health Information Security and Accountability Act by Senator Warner and others, that this is an area that we need to pay attention to, we need to focus on. So I see potentially a lot of bipartisan support, may get rolled up into a larger cyber package, all remains to be seen. I think the most interesting one that I'm watching is the privacy issue. The House Energy and Commerce Committee has jurisdiction on privacy, and was a huge priority for the current chair, Kathy McMorris Rodgers. And she really pushed to get to a consensus deal with the Senate and tried to move that legislation. The question is, with the new chair, will that continue to be a priority for that committee? And that's a big question mark, I think, in a lot of people's minds. The other piece I'll say is related to privacy is, can they cut a deal? We know the two outstanding issues on a larger privacy law is state preemption and private right of action. And I know that there are a lot of Republicans in the House, when this bill first came through, that kind of held their noses and voted for it. And so the question is, with a new chair, and the margins they have in the House, will they still have an appetite to pursue something like that, or will make more critical demands of their Senate counterparts? So those are the key issues that I see potentially kind of coming up in the new Congress.
Yeah, it will be exciting to see who some of the seats are filled, and some of the chairmanships, which are still going through the process of being appointed by the various steering committees. But you're right. Yeah, it really is going to depend on who is sitting in some of those chairs, both in Congress and in the administration level. So it's exciting for us. Yeah. Well, great. Then turning back to AHIMA, what's next on your all's agenda for the coming year?
So much like the sprint that we have with lame duck right now, I think we're going to see a very busy next couple of months with the new Congress, figuring out what their priorities are. As you mentioned, Adrienne, the new chairs of these committees, understanding what they want to prioritize. And then obviously the new players that come in as part of the administration and what their priorities are. So I think we're going to spend a lot of time really digging deep into that, introducing our organization to them, and sharing what our priorities are as an organization. But the other piece I'll say, which is we always look forward to, is every year in March, we do an annual advocacy summit. So this year it's taking place in Washington, D.C., March 17th and 18th. And it's a chance for folks to come and, day one is really all about what are the issues that Washington is focusing on that impacts the healthcare ecosystem. So we talk about TEFCO, we talk about privacy, AI, cybersecurity, all these kind of critical issues, and bring in a lot of the regulators and policymakers, as well as we call our friends and family, like Adrienne herself, to come and talk about these issues and where we think things are going. And then day two is a chance for attendees to go to Capitol Hill and really advocate for key issues that are impacting the health information profession. So we know, a key priority of ours will continue to be the Match It Act. We know we'll be advocating for that in Washington. And then obviously, as things kind of build up those first couple months, we'll kind of further examine what other key issues we want to advocate for when we head to Capitol Hill. So great experience for those that have never been. And it's just an opportunity to really get some face-to-face interaction with members of Congress and the regulators to talk about the issues that impact the profession.
Yeah, it's super important. And as fellow Capitol Hill staffers, both of us, we know how important it is to hear from constituents. And so it's great that you bring people around to meet with their hometown members and members of committees and talk about important issues that AHIMA is working on. So that's a great opportunity and wonderful for your membership to participate in. So that sounds great. Well, I want to thank Lauren Riplinger from AHIMA for joining us on the show today. We really appreciate it and so appreciate all of your wonderful insights for the upcoming legislative and administrative session in Washington, D.C. and beyond. Thanks so much.
Thanks, Adrienne. Thanks for the opportunity.
You've been listening to the MRO Exchange, where we connect healthcare execs. For more insights and to hear other healthcare executives' exchanges, visit the show's page on mrocorp.com and be sure to explore additional resources and thought leadership articles. You can also check out the program page on healthcarenowradio.com. Finally, be sure to connect with us on LinkedIn or X at MRO Corp. Until we talk again, this is the MRO Exchange, where healthcare execs connect.